All of our patients have kind of two components to their initial psychological evaluation. One part of that is psychological testing, and that is something that we do beforehand, and patients fill out a pretty lengthy questionnaire on the computer, and we get the output from that before we see them, and that really helps us kind of steer the evaluation so that we can focus more on what are the pertinent issues for that person. The rest of it is a clinical interview. We're much more interested in hearing about their eating behaviors, their history of their weight, the history of their weight loss attempts, what worked, what didn't, what were some of the obstacles and the things that got in the way of them being successful, what's their understanding of their surgery, how do they cope with stress, because if food and eating is the primary way that they cope with stress, we're about to take that away from them as an option, and they need to have some good plan Bs in the wings. We ask them a lot about their family situation, whether people are supportive of this choice. So it really goes above and beyond what would be sort of a standard psychiatric evaluation that somebody might have if they were just going to see a mental health professional. What's much more common is that patients, over time, as they begin to be educated and talk to other people who've gone through it, they are excited, but they're also realistically a bit apprehensive, and they can begin to recognize that although sometimes the lay public thinks this is the easy way out, there's nothing easy about this. This is a major lifestyle change, and part of preparation is really understanding how this is going to impact you, not just right after surgery, but for the rest of your life. They may be prepared for the fact that they're going to have to eat differently, and they certainly will have to eat a much smaller amount, but they have to be very careful with their eating choices. They have to eat primarily protein. They have to be very careful to get in the right amount of fluids, but they can't eat and drink at the same time. Those behaviors have to be separated. Lots of foods, depending on their surgery, might cause problems, might cause things like dumping syndrome. So they have to avoid foods that are high in sugar and high in fat. Because of some of the surgeries having malabsorptive components, there are issues with making sure that you're getting all the vitamins and nutrients you need. So patients have to be very careful not to eat empty calories. They can only eat a small amount, so everything has to count and has to be nutrient-dense food. Often the patient gets a surgery, but it's the whole family who gets the change, and sometimes people are not as supportive as they could be, and it can change relationships, it can change friendships, it can change lots of things just beyond the number on the scale. So people really need to be prepared for all of those components. One of the most important things is that although bariatric patients might be a bit more psychiatrically vulnerable than other people, more likely to have problems with depression, more likely to have problems with eating disordered symptoms, is that for the vast majority of folks, they do much better after surgery. Their depression improves, their quality of life improves, their self-esteem and body image significantly improve, and their disordered eating behaviors improve. So although we often just focus on the number on the scale and how much weight they've lost, most people have really significant improvements in their mental health as well.